Hello, everybody. Thank you for joining us again in our webinar series. Today we have very interesting news about all the protocols to enter Ecuador and the Galapagos Islands. So Jassi will let us know more about that. And our team, our operations team, our sales team are working really hard to let you know all these news. We will be sending these updates soon. And if you have any question, please let us know in the chat box and we will try to answer at the end of the webinar. So, hi Jassi, how are you doing?
Hey Diego, good morning. Hello everybody. Thank you for joining us on another Monday webinar. We're trying to do it now on every couple of weeks. You guys been hearing a lot from us lately on, as Diego said, on the updates, on the quarantine requirements to get to Ecuador and all of the testing. Things are changing quite often, luckily on a very positive fashion, Diego, as you've been seeing. Just this weekend, we have breaking news, and luckily, and as a coincidence, just before our webinar, so I'm very excited to be able to share more updates on the arrivals to our country and the possibilities to start exploring, and most importantly, resuming operations our end. So very excited to be here, Diego, again, and let me share my screen. And while I do that, I think it's important what you just said. You know, a lot of people, obviously everybody has different types of questions depending on their own reality. So I'm gonna try and make this webinar a little bit shorter than the previous ones, so we allow some time to gather some questions and answers. So
thank you, Jassi. And today we are not only talking about protocols, but also about the new Tropic assistance program. So that is going to be really interesting and really good for our passengers to be safe when they come to Ecuador.
Awesome, Diego. All right, man. I am having. Am I sharing my screen now? Not yet.
Not yet.
All right. So. All right, Diego, I'm having a little glitch here. I'm gonna have to come back to the meeting. I'm sorry. Just
okay.
Hold on. If you wanna start a little bit, it's gonna be 1 minute.
Okay. Yeah. Well, as you have heard and Jassi said, we have new protocols almost every week. So last Friday we have some breaking news from the national committee that is managing the emergency here, and they are easing the restrictions in Ecuador. So now it's gonna be easier to come to Ecuador and the Galapagos. Okay, just let me. Okay, now you can share.
All right, man. Thank you very much. Apologies for this. I updated my computer during the weekend and having issues. So you're probably seeing my screen now. Yeah. All right, awesome. So as you guys can see, we have this beautiful art design that one of our may introduce you to artists did it for us, especially for this presentation. I wanted to start by giving, kind of an overview on what we're working on. And it's pretty much what we've been sharing with all of you in terms of smaller groups, new product designs around outdoor explorations with our self-drives and lodge-to-lodge tracks, and obviously our partners in secluded lodges with, Sunny Lodge, Galapagos Magic, Chilcabamba, among many others of our partners that you all know and love so much. So obviously, a few inspiring images on what a secluded lodge would look like in Ecuador. Lots of social distancing and opportunities to enjoy nature. Obviously, a lot of open space in the Andes to enjoy our trekkings. I've been doing a lot of that lately. Now that in Quito we can move around easily. And obviously, we're also thinking about urban escapes, right? Within these updates that we're getting from the Ecuadorian government, and the arrival in places like Quito and Guayaquil, and the freedom to move around without quarantine requirements, we are looking at how we could adapt the urban adventures we have developed to make them safer, more private, and allow some social distancing with and for our clients. So lots of exciting news that we're going to be sharing in the next couple of weeks. But I guess the most important thing is the technical aspects of this process that we've been living and working on for the last several months. Obviously, you know, we are seeing here as the way forward, the working in different pillars. Health and safety, we know that is a very important and probably the most important element of our operations right now in terms of the way forward to resume operations, right? So we've been working nonstop with our protocols, getting the guidelines from the WTTC, from the ATTA, from all of these international organizations that are looking at making our operations safer, and most importantly, to get some sort of guidelines that would be applied in many different countries, hopefully. And we are seeing this not as an added value. We really hope that all of our partners all over the world join this movement of trying to get some sort of standards so our clients feel safer to start moving around again. Obviously the digital world, it's very important right now. We've been working from home, at least Diego and the rest of the team. I was kicked out of the house. I had to come to the office for the last couple of months because I'm way too loud for the family. But you know, the digital world, it's really developing in such a way that we are also working on many different fronts to make our processes more efficient without the need to be in the office back again. So you'll be seeing a lot of those benefits in the next coming months as well. As you know, well, it's part of our DNA at Tropic, the positive impact of our operations. Nowadays, we feel like we have a tremendous responsibility when we talk about resuming operations, not only for our own businesses and obviously the responsibility in front of our clients to give them a good time and experience in Ecuador, but also the communities and the locals that work with us are really struggling on their economies, and we have a tremendous responsibility to try and incorporate them back into tourism, and the tourism circuits will start operating very soon. As you know, Ecuador, the macroeconomics of Ecuador is on a very delicate situation, and obviously the rural areas will be the least attended by our governments in the near future. So as the private sector, we can get together and start thinking about, you know, social inclusion, poverty alleviation, and obviously conservation of nature in the next probably couple of years. It will be, we have an important role to play here. Flexibility, as you guys know, we are trying to be as flexible as we can, not only with the cancellations and rebookings that we've been leaving, but also thinking forward in the future on our new rates. We have more flexible booking conditions. We have more flexible cancellation conditions, especially those that are COVID related. And product adaptation, I guess we've been very lucky at Tropic because we have had the right product for this specific period of time. But obviously we continue thinking about, well, what's next. Diego and I will be working in the next couple of months with a lot more focus on the luxury catalog, because we're seeing a lot of interest for families who would like to have a more private and exclusive excursion around here. So we're going to be sharing a lot more around, you know, high-end vehicle transportation and villas and private homes available for rental, private jets, and fast tracks and VIP lounges in the airports, etc. So we'll be sharing a lot more on that front really soon. Today, obviously, we have prepared this beautiful design and presentation to share what's the latest on the possibilities to get into Ecuador. So basically, and one of them are taught about, you know, this is an update for arrival in Ecuador and the safe passage to go to the Galapagos, because right now actually things are getting a little bit easier to understand before flying to Ecuador. Apart from the usual, you know, having a passport valid for at least 6 months, the travel insurance, even though it's not mandatory, is something that we highly recommend. I think it's very important. Besides the fact that we will be launching our new Tropic Assistant program today with you guys, we do encourage people to still continue traveling with their own insurance. And obviously, confirm services with us. That also, I think it's a very important element to be able to showcase the authorities that you're coming on an organized trip. But obviously, and the key element here is the PCR test, right? As you might remember, just last week, we updated you guys that the PCR test was required to be taken seven days prior your trip to Ecuador. Now that time is extended a little bit. Nowadays, we are required to do it with 10 days prior to arrival in Ecuador. So that's one of the most important elements in terms of updates, that this test need to be brought from abroad and presented on arrival in Ecuador. And in terms of, going back to the PCR, you have the possibility to arrive with this test. If you come obviously with positive, you will be required to go on a mandatory quarantine. If you don't come with the test, or a client of yours don't come with the test, you'll be required to do the quarantine, obviously. But if negative, and this is the biggest and breaking news we have today, is that if negative, you'll be able to free and move around and explore Ecuador mainland from now on. This just changed over the weekend. So, and that's huge, for tourism in Ecuador mainland. That usually is the first part of your trip in Ecuador and the Galapagos Islands. So that will be, a big change. Obviously, the Galapagos local test required to be taken before going to the islands. This is still required. We're going to cover a little bit around that in the next couple of slides. That is actually this one. So basically, once arriving in Ecuador, again, show the results of the PCR test carried out in your own country as negative, obviously, hopefully, right? That's the whole idea. And then whenever clients have to go to the Galapagos, they will have to take a new PCR test in Quito or Guayaquil to reconfirm the test result before flying to the Galapagos, right? This has an additional cost. It's more or less in the range of $120 per test per person, obviously. And that will allow you to go into this Galapagos safe passage, right? We're gonna go a little bit more around that, but basically, as soon as you get the negative test, you will be able to go to the islands. But now that you are not required to do a quarantine for Ecuador mainland, which was the case last week, now you can actually go and travel a little bit around Ecuador mainland. We could easily go into Quito, you get your transfer, go to your hotel in Quito. We will arrange for your testing to happen depending on how many days you have in Ecuador mainland, because remember, the test to go to the Galapagos needs to be presented with 96 hours of the results. So you don't want to do that very early if you have a full week still to travel around Ecuador mainland, right? So we have to calculate when exactly to do that testing. But in general, I imagine it will be on your hotel in Quito, then you do your test. We could explore Quito for that day and then move on to one of the nearby destinations like the Cloud Forest or the Northern Andes or the Southern Andes or a Volcanoes Avenue trip. And then with the negative test provided to your clients via email, you could connect to the Galapagos Islands. So that's kind of that's the most important element to understand. And yes, the local test is still required to go to the Galapagos. And yes, both Ecuador and the Galapagos are reopened, right? Tourism is happening in Ecuador. We already have international travelers getting into Ecuador. We already have international clients going to the Galapagos Islands. So this is actually happening now. This is not, okay, when this is gonna start? Well, this is already happening, right? Within the arrival in Ecuador, you have to fill a traveler's health declaration. This was implemented even before the pandemic, but you still have to present that. Once you get into Ecuador, obviously our guide and private transportation will be waiting for you outside the airport. Remember that now nobody's allowed to go in the building of the airport. So our guides and drivers will be waiting outside the airport and waiting for you, and obviously following our protocols at all times, right? To transfer you to a hotel or lodge or hacienda. One thing that is very important to keep in mind is that in Ecuador, the use of masks in public spaces and social distancing is mandatory. So you'll be required whenever, for example, on a transfer in one of our vehicles, you will be required to wear a mask. Your clients will be required to wear a mask. And we also consider a mask, the masks a personal item, right? We have a lot of debate. We've been talking about these masks use and shapes and forms and materials for the last several months. We're also learning a lot about that, trying different things to seeing which ones we feel more comfortable with. And as you probably know, is not all of the masks are the same. We don't feel exactly the same using one or another. So we decided and defined that a mask is not something we will be giving away. It's something that obviously we will have on our first aid kits in case, you know, a client forgets or loses or breaks his or hers. We'll be able to provide an additional one. But the idea is for you to bring your own masks and as many as you want, because we feel that you need to be comfortable and you need to feel safe with your own mask. So that's an important thing that we wanted to say. We had a lot of debate. We feel like also there is a liability for our partners as well as for us. You know, if we start giving away masks and then for whatever reason a client gets COVID, we could be pointed as responsible because we didn't give the proper mask. So that's an element that we gave a lot of thought, and we feel like it's very important for you guys to share to your clients. And hopefully you feel the same way, that people should be carrying their own, even though, because in order, whenever they leave the airport or their plane, when they arrive in Quito, they will have to wear a mask. They will have to fly with a mask. So they will have to bring a mask anyway. So remember, we launched a few weeks ago our Green Ecuador Safe Travel Plans. So we still believe that the majority of people will be keen to go back to the Galapagos, and they will be keen to go to the Galapagos as soon as possible. So this adaptation to provide a safe area with focus on the outdoors, a lot of open space and beautiful farms where people could spend some time while they wait for their PCR test result. Is going to be, you know, the most interesting thing, apart from being in Quito. Right now there is no quarantine, so if clients desire and want to stay in Quito and explore Quito, there is no problem. But we do feel, like we said many times in the past few weeks, that we are pretty sure that our clients will be more comfortable and looking for more open space sort of destinations and properties. So we do believe that our Green Ecuador properties will be very popular. So, and all of those are very easy to connect directly to the airport, as you know, from Otavalo, from Cotopaxi, and from the Cloud Forest. We already explained, is no more than 2.5 hours drive. So the possibility to connect directly to the airport is a fact, right? Remember that the results, this is very important, the results to get the test right now are between 48 to 72 hours. There is more and more laboratories available, and I'm pretty sure that we can work things out within the more technology comes into Ecuador for us to provide quicker turnover for the results. But I would say that for us to feel comfortable and safe to be able to ensure the connectivity with your Galapagos cruise or your Galapagos program and your Galapagos flight, it is important to allow some time for people to be tranquil and enjoy and explore Ecuador mainland. And remember that we are huge promoters of Ecuador mainland tourism, right? And Ecuador mainland tourism need tourism as much as the Galapagos Islands as well. And yeah, and with the negative result, they will arrive via email and digital. You can continue to the Galapagos, right? If test is positive, then the quarantine will be required, and then our emergency protocol will kick in and will help your clients with whatever arrangements it's needed depending on their conditions. In terms of flying to the Galapagos, once at the airport in Quito or Guayaquil, you need to show, you know, the usual documents, right? We do have, there is one specific and special requirement from the Ministry of, that is given by the Ministry of Tourism to accredited tour operators and lodging companies in the Galapagos Islands, right? So please make sure that you have that covered, especially for the ones who are booking direct. Some of their arrangements in the Galapagos Islands, it's important for you to make sure that your supplier can provide you with the official document that is given to the tour operator who is accredited to be able to give you that document that will allow you to move forward with the process of buying your transit card, which is the entrance to the province of the Galapagos, and all of the other checks of luggage for introduced species and etc. So that's also a new element that for any of Tropic clients, you don't have to worry about, because as you know, we have our office in the Galapagos. We are recognized officially by the Galapagos government as well. So we can provide that, and we will provide that for our clients. So there is no issue there, but just make sure that you have that covered with, for example, for the ones who book their cruise directly, make sure that your operator has that capacity to provide those documents, right? And then the transit card and the scan for introduced species is mandatory. It's been always there. Remember, the Galapagos, COVID or without COVID, we're still a national park and very fragile ecosystem that needs to be protected by introduced species apart from COVID. So luggage will still have to go through the process of control for any introduced species. One new element of this process, that even though the majority of our clients, not to say all of our clients nowadays, are already checked in whenever they go to the Galapagos by our own team or themselves, you have to go through the checkpoints of the airline companies, because the airline companies at the counters are the responsible ones to review your PCR test that is negative. So you have to go through that process to check in your luggage, and while you do that, you have to present your PCR test result. You know, this is not only something that our guides or drivers can do for you. You have to go through, present the test at the airline, and then you get your validation to go through the control gates and then to your VIP lounge before your flight to the Galapagos Islands. So this is a new element as well. So remember, you have a few new elements to go to the Galapagos, all straightforward. It doesn't seem like something that is unreasonable, but you do have to make sure that your clients will understand that there are certain standards that will have to be met in order to get there. And obviously, I don't know how it is in other countries, but in Ecuador, your temperature will be taken 20 times a day, and you'll be giving alcohol and gels to clean your hands on every single door that you go through. So that's something that I'm very used to nowadays. You know, in every single doorstep, you have someone with a thermometer and gel. So that's something that your clients would also have to be used to or accustomed to. It's for everybody's safety. So I imagine that there won't be an issue. But yeah, it's good to keep in mind that we have some new standards to go through. Once in the Galapagos, honestly, things remain the same. You know, the migratory line, especially to pay the entrance fee to the Galapagos Islands, is going to still be there, you know, as ever. So we do encourage you guys to book your VIP services with us. That will allow for our team to make the prepayment of the entrance fees and to collect your bag and do all of the migratory process for us while we enjoy a coffee. Obviously, we do encourage you guys to continue using the Welcome to the Galapagos expedition, which is using our operation at the Tabaca channel with our snorkelings and kayaking and standard paddle boards. They're ready and waiting for exploration. So that will be, you know, we always feel that is a great welcome to the Galapagos Islands. That's the first impression that sticks. It's a fantastic icebreaker for all of our clients doing land-based with us. So we do encourage that. And then as for the clients doing, you know, cruise-based experiences, well, the process is most likely the same. You're going to have the representative of the cruise company waiting for you, and then you're going to do all of the transfers back to the docks and to the cruises. Talking a little bit about the cruises, we are doing weekly calls with a range of our partners cruises. We have talked to, you know, folks like Metro and Eco Ventura and Golden Galapagos and a few others, and some of them have different approach in terms of when they're going to resume operations. Some are already sailing with clients across the islands, as I said. So we do have to review. Don't take it for granted that all of the boats are already sailing with clients right now. So we have to make sure that you know what's the deal and the status of each of these cruise companies in terms of their own plans to resume operations. And then they have their own protocols, but most likely The idea right now is everybody's tested, you know, crew as well as clients arriving into the Galapagos. So, you know, with the basic criteria of protection, the idea is that nobody will be infected with COVID, and they will be able to have a good time on their holiday in the Galapagos. And obviously, once you leave the airport, you know, our team, our guardians will be there waiting for you just outside the airport to move towards your hotel, your cruise, or whatever services you have booked with us. So this is sort of, Diego, I don't know if it's clear enough, or there is something missing on my explanation in terms of the new regulations. It's I think it's pretty straightforward, right? No more quarantine required in Ecuador mainland if you arrive with a PCR test that is negative, right? And then if you want to go to the Galapagos, a local test is required, and the results needs to be within 96 hours before your arrival into the island. So that's pretty much, it's getting, thank God, it's getting easier and simpler to explain. And that's pretty much it, right?
Yeah, Jassi, I think we can answer some of the questions related to this. Jim McDaniel is asking, will the quarantine still be 14 days? For example, if someone has a positive result in their test?
The quarantine, if you arrive with a negative, the idea, Jim, yeah, it's a good question. The idea is that the date is relative now, because you do have, for example, to quarantine for, it seems like the days that they are applying now is 10 days, but you still have to do your test. And then whenever you present your negative, you are allowed to leave earlier your quarantine. If you arrive without a test, or if you have to do a local test and you have to quarantine for 14 days. So we are really, in that sense, Jim, trying to understand the new adaptations, but definitely quarantine will be required, and to be able to explore Ecuador if you arrive with the negative. And if you arrive without a test, you're gonna have to do a test, and you will have to quarantine for sure.
Yeah, another one from Paul Webster. Are the tests available over the weekend too, or would you need longer if you're on a weekend?
No, actually, I took a PCR test a few weekends ago, and actually went on a Sunday, and it was straightforward. There are many laboratories doing the testing. The processing of the tests might be a little bit delayed. If, for example, you do your test on a Sunday, it's not going to be processed on a Sunday, because most likely the laboratory won't be working on a Sunday. Then yes, you might have to wait a little bit longer for the result of the test, because it was taken during the weekend.
Okay, one more from Riley Day. Whereabouts can clients stay while waiting for their PCR tests? Does it have to be at an airport hotel, or can they travel throughout the mainland?
They can travel throughout the mainland. That's the biggest and fantastic news, right? Until last week, there was a huge debate while the quarantine or not quarantine while you wait for the Galapagos. But the big change now is that you can actually move around. You actually arrive with your negative test, and you're free to move around Ecuador mainland. For example, if you don't have a Galapagos trip included on your program, you pretty much arrive with your test, and you're free to explore. And if you have, for example, talking about, you know, an European that has 2 or 3 weeks time to go about Ecuador, then you can travel and explore for a couple of weeks, and then we calculate when clients should be taking the test in order to give time to get the results, and then connect to the Galapagos. But that's the biggest news right now, that the test won't be required.
Great, thank you, Jassi. Renee Davis is asking, does Tropic help to arrange the test for the packs? What is the approximate price?
Yeah, that's we take it for granted, Renee, that we will have to do all that, and we are actually prepared to do all that. We are discussing it with a couple of private laboratories. We want to have a few ones on our pipeline to be able to use them, but we are definitely sure that we'll have to be the ones coordinating it, not only because we want clients to get an official test, because you have to take a test with an accredited company, first of all. Second, because we are most likely will be doing the follow-up of the results of the test on behalf of our clients. We don't want clients to be stressed out about those tests. So our operations teams, our concierge service will be looking after those results. So we definitely will and want to take care of that, because we believe that the peace of mind the clients will get will be tremendous, and their experience is going to be better, and they're going to like us even more. So we definitely want to get involved with that. And the cost is around $120 per test, right?
Great, thank you. From Trista Gage, are masks required on board the boats in Galapagos and while on shore excursions?
Yes. Like I said, the use of mask is mandatory within the public spaces, and that includes the national park, and that includes the boat. So that's something that will be mandatory still, Trista. Yeah, I know it's not ideal, but I guess that's part of the new normal, right? That people like to say, and I have to accept that there is a new normal meanwhile. So yes, in Ecuador, it's mandatory by law to wear a mask.
Great. And the last one now from Pelin. If someone gets a positive test result within 10 days of travel and has to cancel as a result, will the cost of the program be fully refundable? None of us want someone to travel with a positive test, so what are the ramifications?
Yeah, I mean, we are being very flexible for anyone who cancels due to COVID. And I guess that includes, getting sick, right? While they're not here. So part of our flexibility is to work with our partners on a case by case. In case of Pelin, it'll be easier because we control your entire program here, and we are able to cancel that. When it's about the cruise line companies, we have to discuss that on a case by case scenario. But specifically, Pelin, with what you have in mind, Tropic for sure will work with you and ensure that your clients can postpone their trip for a future group departure, or cancel their trip, right? Hopefully they will get better, right? If clients get sick here, then we're gonna go about our new Tropic Assistant program. But the idea is for the program to kick in, and then we trigger all of the local support that we have designed in order to separate this person from the group. And then obviously the rest of the group will have to make decisions about their own travel plans in order to move forward, especially when we talk about groups. But definitely the person who start presenting signs will have to be treated specifically.
Great, Jassi. Yeah, those are the questions so far. I think we can keep on with the
cool. Yeah, please keep the questions coming here. This is kind of a second part, so that was a good break because it covers a little bit of the new requirements, and then what we're thinking in terms of our new assistance program, right? In general, for the ones I see a lot of friends and clients, but more friends that I have, I even know them personally and love them very much. Thank you for joining us, guys. But so the guys who really know us know that many of these services have been available, but they've been kind of spread out within our added values as a company to you. Now we decided to put them all together in one package and call them the Tropic Assistant Program. That obviously includes the concierge services, our 24/7 emergency phones, and etc. As you guys know, at Tropic we have two, right? We have one concierge service assistance in Ecuador mainland. There is Paola, that some of you probably already know her because she's been doing the updates on the protocols, a presentation that is tailored to all of our partners who want to learn more about our protocols. And we also have Bolivar in the Galapagos Islands, who is focused more on whatever is going on within the island. So the concierge services are still there, and the emergency contact and phones for Ecuador mainland and the Galapagos, as I said, right? Then the on-tour managed services, which is a program that is now became a bigger program that is dedicated to our guides and drivers, right? And this, when we talk about assistance, why do you talk about assistance if it's about guides and drivers? Well, basically because the guides and drivers are our faces, are our brand ambassadors, and finally are the ones who will be handling the situations related to COVID or not within our operations. So the importance of the support that we give them, it's key, right? In general, you've seen that our own tour management is kind of an assistance to our guides. You know, what do? We have the situation, how is the group doing, etc. So all of those connections that happen on a daily basis, because even though the concierge tackles the client front, will be calling the client and making sure, giving a welcome call, seeing that everything is running smoothly, providing kind of a random call. The on-tour manager is kicked in at all times. So we are all the time monitoring our client's journey, and this becomes, within COVID post operations, it's going to be even more important. So we want to make sure that everybody is feeling okay and that things are running smoothly. So that's a very important part of it. And now, and which is, you know, the big deal, is our Hummingbird, Toucan, and Albatross first aid insurance. That's kind of the biggest thing that we're going to be presenting in detail in a few minutes. So first of all, obviously, and the most important, biosafety protocols and crisis management. So we've been working a lot, our operations team has been working a lot with our suppliers and our strategic partners on the protocols. As you know, we probably were, on April, we had our protocols ready. Obviously, we've been adapting the protocols. The Ecuadorian government and the Ministry of Tourism, if there is one thing that they did it right and right on time, was pretty much working on protocols. So we very early during the pandemic had all of these guidelines coming from governments. We've been working with partners in different countries in South America to gather their own guidelines and best practices. And with all of that, we were able to design our own. Apart from that, we've been following up within the renegotiation of rates. We've been renegotiating as well, you know, the capacity of our suppliers and partners to be in tune with this trend and this need and requirements related to protocols. So our operation is monitoring that everybody is adhered to those, right? And obviously our negotiations teams, looking at the rates, will be asking for the compliance of these protocols in order to include our partners on our rates. So all of that is covered. So we are not thinking about, you know, having gels on vehicles and masks on first aid kits. This is a value chain, and we need everybody to collaborate. One cool thing that I think is important for everybody to know is that tourism has been going for a couple of months now in Ecuador for domestic travelers. As I think we've been sharing those news with you guys, but you know, since we were no longer in lockdown and the regulations were less strict to move around, especially in Ecuador mainland, all of the hotels, for example, around Quito and around Guayaquil did reopen. So there is a lot of, you know, I wouldn't say that they have been training with domestic travelers to welcome international travels, but there has been a lot of training and learning with, you know, for our partners in front of our clients. You know, we also own Chilcabamba, and we've been full for the last couple of months, and that's been fantastic because we were able to understand, you know, where are the critical points and where people feel a little bit more stress or less stress. Meals is an issue, you know, so you have to work out the timeline so people are not all together eating, for example. But in general, I think that people are so excited to be outside and in the outdoors that we felt like it's more a situation of goodwill, you know, the attitude towards exploring and enjoying your time than all of the other rest of the protocols, which is obviously there is a checklist and there's a lot of common sense around that. So I think that falls into the constant training and development, right? Our operations teams, especially Paola, has been working a lot on our Guardians, our Galapagos Mountain and Amazon Guardians program. I am sure that you probably have heard of this before, but if you don't, this is a program that we started a few years ago. Is a program dedicated to our guides and drivers, is a program dedicated to our ambassadors on the ground, is a program dedicated to a community within our value chain that is probably the weakest one, is the more vulnerable one, because these guys, for example, for the past 5 months, they haven't had a job, because if they are not working, they are not collecting the money. So we decided to stay very close to them, even though we are not able to supply, for the income that is lacking. We did try to keep them in the loop of our plans, on the updates, to try and explain what we're seeing in the marketplace. We're speaking with all of our clients every once in a while. So we're learning a lot from you, and we are trying to share that with our most important partners and your most important representatives here in Ecuador, which are the guides and drivers. So we ran a few training programs around protocols. Now within the context of COVID, we've done a range of different trainings depending on the time of the year. And we've been covering a lot, first aid, the storytelling, how, nowadays we don't want everybody to talk about COVID within a trip. We have to be able to present how best to talk about the issues, but also not forget that clients are here to trying to have a good time. So how we're gonna combine, the reality and the local situation and what Ecuador is all about. And obviously crisis management, we know there might be issues, and we know that if there is a group traveling, a person might not feel well. It doesn't matter if COVID or not related, but we have to take the measures, and we have to know how to be able to manage those crises. So we are working a lot behind the scenes to be able to not only us master the process, but also to explain and train the people who will be in charge of implementing those. So that's obviously very important, and being able to have that pool of guides, to have that group, to have that program in place within this context puts us on a very interesting position to have, a unite front voice and message to share with our closest partners. Then going into our new first aid insurance, right? So this is all of the previous ones is kind of more our own service, like it's the service that we offer you and your clients while here. But now we decided to go a little bit further, and we renegotiated an insurance that we had last year already implemented to include in all of our clients' programs, right? So basically, this is not a travel insurance. It shouldn't be an alternative to your own international travel insurance, but it is a first aid insurance, right? And the idea is for you to have a coverage of $4,000, up to $4,000, with 2 medical assistant visits to hotels or anywhere in Ecuador. It doesn't matter if it's in Quito, Guayaquil, Coca, one of the Amazon lodges, or the Galapagos Islands. We have via video conference, you have medical consultation 24/7. You have prescription medicine up to $400. You have emergency hospitalizations up to $1,000, medical transfers within the country at $1,800, and even a dental assistance of $200. So this is included in all of our programs, right? So you don't even have to ask us. You don't have to worry about it. This is already included. This is part of our Tropic assistance program. This is support for our guides. This is support for our drivers. This is support for our own tour managers and concierge services. And this is obviously thought about your clients on the ground. We feel like this is a very important tool when we need to handle a crisis. We have also those resources to be able to apply to resolve a situation within our clients. So why do we say that conditions apply? Well, because some of our clients book a few services with us, maybe a transfer or a hotel, and it doesn't matter, we love those services as well, but then the rest of their Galapagos journey, they will book elsewhere. So those programs won't be included. Right? What we can do, if you pay an additional fee, you could incorporate one of these programs into the client's journey, and then your clients will be covered also within using a third party, like a cruise in the Galapagos Islands. If you want us, we can work with you on that. That's not a problem. Obviously, we would love to be your partner here and take care of the whole program with you guys. I think post-COVID, this is going to be a conversation that we should have with all of you, because I imagine the nightmare that is being for you to be handling rebookings and cancellations with 20 suppliers in one small country. obviously we feel like we could be your one-stop shop in Ecuador and the Galapagos Islands. But if not, if you guys want to continue with your business model of having different suppliers, then we are open to this, because we feel, like I said, that this is very important in terms of the recuperation of our business. This is all about showing clients that we care about them, that we know what we're doing, and obviously the health and safety is a priority to resume operations in Ecuador, and that's why we've been working on these fronts. Then we have a little bit of a bigger bird, a toucan, and that includes a little bit more of a coverage, right? These are upgrade options, and they come with a cost. The cost is minimal compared to what's available in the market, but the coverage are considerably higher. So we're talking about from $4,000 on a hummingbird, you have $40,000 coverage for clients with the Toucan program. You have unlimited medical assistance visits. We have $500 of prescription medicine. You have medical transfers included. You have repatriations, medical or funerary included. You have sports practice included. So thinking about the Galapagos, you have up to $10,000. You have your snorkel there. You have your kayaking. You have your stand-up paddle board. So that's covered as well on these upgrade choice. And then hotel expenses due to convalescence up to $900. So, and this has an additional $4 per day per person, right? So this is same concept as the other program, but with more coverage. And then we have the Albatross, which is, a much bigger bird, and the coverage now it's incredible. It's and this is a program that, as far as I understand, is exclusive to us in Ecuador. I don't think anybody else have that available, especially at the $6 per day per person price. You have prescription medicine to $1,000, prostheses included, medical transfers included, transfer of a relative included, repatriations, medical or funerary included, sport practice again, lodging of a relative, escort services for minors and elders included, difference in airfare due to delay or early return due to serious disaster at home. So it's a powerful program and coverage. And I think that, it could be interesting, for, clients who handle more VIPs or high end, that the $6 per day won't make a bigger difference on the bottom line of their whole program. This is something that could be very interesting for all of you to consider, especially thinking about what clients will be thinking right now. So, and this is a whole negotiations that we've been going through for the past 3 or 4 months to be able to launch this program. We don't feel this is, again, we don't feel this would change your international insurance. I think this is a complementary one. The idea is that whenever you have your international insurance, you have all of that bureaucracy to go through. Whenever you need some little detail here, you need to see a doctor because you're unwell, then you'll be able to use ours and just forget about yours for a more serious situation if you feel is needed. So that's pretty much it, Diego. Apart from obviously your beloved Agent Hub, I don't know if you want to give an update on what's happening with the Agent Hub and the South American Academy, and then we can jump into the question and answers again.
Thank you, Jesse. That was great and detailed info on the assistance programs. And yeah, just to let you know that we have these amazing tools, the South American Academy, where you find courses on Ecuador, the Galapagos Islands, and some other destinations in South America, and also the South American Visuals, that is our picture and image library that we have with great images from Ecuador and South America as well. So if you need access, if you don't have access already to these platforms, please let us know and we will send a user for you to use these platforms. Yes, and just one last question, Jesse.
Sure.
From Paul Webster. If we can find people happy to travel soon, is availability looking good for the rest of this year, Christmas and early next year?
It's looking fantastic, actually. Well, the situation is critical. There are many spaces being released right now. Some of our clients are still, just this morning I was looking at the new movement during the weekend. and we see some tours being canceled in December. So it's looking very promising. It's looking, you know, honestly, Paul and everybody, I was not very optimistic about this year with what we live in the you know, during the pandemic. But right now with these changes, we have a lot of clients, even some people that are making questions there, considering to not to cancel their operations in October, November, December. And I just spoke this morning with our staff meeting that the attitude right now should be, you know, we are more open to resume operations, and we should be gearing towards restarting it. Luckily, you know, with us, everything is in place. You know, I have had a transportation company parked outside my house for 5 months. So vehicles are ready, you know, the team is ready, the program is there, the promotion and the promotions are there as well. Rates are also available. And we still have some bookings in the books for this year. So I do encourage for you guys. I know that with folks from Europe, it's a bit different because you might have restrictions to leave your own country. Specifically, some specific countries are not recommending any trips outside of Europe. But I guess for all of our partners in the US, you know, flights are there. You know, we already have flights and things are happening. So I think that we should be, obviously it depends a lot on the client who is willing to travel, who is willing to go through, you know, the hassle of wearing a mask and the social distancing and all that. And obviously the ones who are still afraid of leave their homes shouldn't leave their homes, but the ones who are eager to explore and get outside, you know, the sun is shining around here. So it's a great time to explore Ecuador.
Great, Jesse. And well, one more question from Rene. I'm getting this question from travelers. What is the current in Ecuador with hospital bed space? In the unfortunate situation, we did have someone who needed hospital bed. Is there concern over that space and the care they would be able to receive?
Excellent. Rene, that's an excellent question. And I have a good answer to give it to you. Because, well, Guayaquil, the situation in Guayaquil that you heard in the beginning of the pandemic that was critical, the system was completely collapsed. Now, Guayaquil is helping Quito. You know, we're getting medics and supplies coming to Quito because we are living now a growth of our curve in the Andes. Nothing to worry, or, well, actually everything is to worry, but nothing to be so afraid about. Even Quito now, since this week, the curve is going down, as well as the use of beds. So there are beds available in both main cities, and that's a relief to be able to cater for emergencies in the case of a very complex case scenario that we have to handle.
Great. And one more from Pelling. If during the program a participant shows symptoms, how will the quarantine work?
Well, Pelling, we have to, you know, this is obviously a situation that we haven't lived. So within our protocols, first of all, the client needs to go to a hotel. Really, it really depends on where the client is, but they won't be able to move around. If they're in the Galapagos, we'll have to find a hotel and put them on quarantine there and separate from the group. If it's in Quito or Guayaquil, the same thing. But I think the important thing is that we'll have to split the group and work the emergency with that particular client. And obviously, in your case, we're going to have to reach out to you and start making decisions all together, because each company have their own internal policies as well. But what we will do is immediately activate our Tropic Assistant program. We will immediately reach out to the insurance. We will work with our doctors. We'll visit the patient, obviously, that is already separated from the group. That's what we will immediately do. And then obviously, depending on the conditions of the client, we will have to decide what further actions to do. Probably the first one will be testing to just make sure that is actually the problem is actually related to COVID or any other disease, and then we'll take it from there.
Also related to this, Pelling is asking if we are at Galapagos and they are traveling with others, the patch showing symptoms, can they get a test at Galapagos until the test result comes back? Will it be only them quarantine? What will happen to the rest of the people on the tour? And if there is clinics in Puerto Ayora and Puerto Villamil dedicated for this?
Right. Again, Puerto Villamil, you know, let's start from the more complicated to the easier ones. Puerto Villamil has a health center. There are no COVID cases as far as the last time I checked there. We most likely should evacuate to Puerto Llora if medical assistance is required. And because we have more private doctors that will be available to use within our own insurance. So that will be one specific case, right? In terms of what happens with the rest of the group, I think it really depends on the rest of the group decision, right? What we will have to discuss the situation with everybody. Some people might want to carry on. Some people might want to test, right? Just to make sure that they are okay. So we'll have to work with our partners like you, as well as the group, you know, and make decisions all together. If there are health centers available in Santa Cruz and Cristobal has a fantastic hospital, as well as Santa Cruz we have the access to the private practitioners there. And the first question about the testing, yes, tests are available in the Galapagos. Actually, the crew members from the boats are doing their testing in Baltra, for example. So that's not an issue. We will be able to do testing there.
Great. And the last one from Jim McDaniel. So medical insurance is not required to go to the Galapagos. It is just suggested, and some is automatically included with your Hummingbird program?
Well, yeah. I mean, insurance to travel to Ecuador is not mandatory, but it should be. I guess right now and within the context that we're living, insurances are definitely something that will give clients a peace of mind. Our own, like we said, shouldn't be treated as a travel insurance. It's more of a first aid insurance that will be available. And yeah, you're not required to bring an insurance to Ecuador, neither to the Galapagos Islands.
Great, thank you, Jassi. Thank you for all the explanations. I think it's very clear. And yeah, you will receive more information in your inbox this week with all these documents and the written rules to enter Ecuador and the Galapagos. If you have any question, please reach us to us. And I think that's it for today's webinar. Thank you, Jassi.
Yeah, Diego, thank you very much, guys. And thank you so much for your questions. I was expecting it to be like this. Obviously, you might have a lot more. I guess the conditions are outlined, right? There is a lot of decisions that needs to be made, also depending on your own business plans and travel style of your clients, as well as even the profile of your clients. We are ready to resume operations with you. We are counting on your support, but also we are more than happy and open to have conversations with you and reviewing possibilities and options and alternatives to adapt to whatever your plans were for Ecuador to continue doing. But we are, for the first time in 5 months, optimistic about the situation, and we feel like we are very close to start, you know, resuming operations. Obviously not at the volumes that we would expect for 2020, but definitely we feel like it's going to be a great thing to start bringing some clients here and, you know, start working again on the operations front. Right. Thank you very much, Diego. Thank you very much, everybody, for joining us, for your fantastic questions. And if there are any recommendations or additional questions, you know where to find me. I'm very easy and available to all of you, as well as Diego and the rest of the team. And thank you so much for your support during these months. And we really hope that the next webinars is about some new clients already here. Un abrazo and have a good week, everybody.
Bye-bye.